Good morning, everyone. Welcome, and thank you for participating this morning to our Resources for Veterans in Connecticut. My name is Jeanette Baker, and I am the Marketing Coordinator here at United Way of Connecticut. Just a few housekeeping rules. You are all on mute, so please use the Q&A for questions. If I cannot get to them at the end of the presentation, I will respond by email. So as I said, today's webinar is about resources for our veterans, and connecting veterans to the support they deserve is essential to helping reduce risk of mental health issues and transitioning them back to civilian life. So, a quick overview of 211 for those who may not be familiar with us. What if you or someone you know needs help? This is where 211 comes into play. Dialing 211 will connect you to a trained contact specialist 24/7, 365 days a year. Our contact specialists have access to a comprehensive database with a multitude of services in your community. It's free and confidential. And there's multiple ways that we connect to people. You can either dial 211, you can visit us on the web at 211ct.org. We are accessible by TTY. If you're from out of state or if you're having some issues dialing 211 either through your work phone or through a cell phone, you can use our 1-800 number, 1-800-203-1234. We also have a chat feature which is available Tuesday through Friday from 8 to 2, and on our website you can find the icon, which I'll show to you when we go to the web. It's located on the top right of our website. We also are venturing into texting for resources. So if you text any of these keywords, CT Warm, CT Food, CT Recovery, to 8898211, you will get resources related to heating, to food, or to substance use disorder resources. So we feel that it's important to offer multiple doors for people to connect to resources. So this is why we really look at various ways for people to connect with us. So with the number of suicides among veterans increasing, it is really important for the community to be aware of resources that can help to prevent suicide. 211 Connecticut is accredited by the American Association of Suicidology. In FY19, our contact specialists responded to 1,400 suicide prevention calls, with 513 of those requiring an active rescue. So inside, if you or someone you know, or you're working with someone that you feel they're in a crisis situation, that they may be contemplating suicide, in Connecticut, you can either dial 211 or you can dial the hotline, the National Suicide Prevention Hotline, which is 1-800-203-1234, to speak to a trained crisis worker. That line, like 211, is open 24 hours a day, 7 days a week. We also work with the Connecticut Suicide Advisory Board on the Prevent Suicide CT website. So if you were to go to this site, give it a second to come up, there's actually under resources a special page for resources for military and veterans. So here you will find a gamut of different websites that has information about suicide prevention and what to do. Also on this site are warning signs that you as an individual can look for, risk factors, as well as other resources, you know, after a suicide resources, resources for workplaces, but definitely I wanted to call your attention to resources for military and veterans. So going back, so this is one resource for the target population of veterans. Another resource is our 2-on-1 e-library. The 2-on-1 online e-library is a collection of papers on some of the subjects that callers have asked about over our 43-year history as a human service call center. Each document in the e-library gives a quick overview of the subject and points the reader to services and resources in our database and to web links to find more comprehensive detail on a subject. As you can see here, it's divided by topic, one of them being the active military and veterans topic. So if we go to the e-library and we select active military and veterans, you'll see here a variety of topics that would be of interest to active military personnel or veterans. It runs from resources and support for families and military personnel. And as you can see, it starts out with a quick introductory topic, information about the topic, and then as you scroll down, you will find links to various resources. For example, here is one about the property tax exemption for veterans. Perhaps many don't know about this. So in this e-library paper, it talks about what the program is, who qualifies, how to obtain your military records for to apply for it. And then another one, another very popular one for this particular topic is Soldiers, Sailors, and Marines Fund that many people may not know about. I believe it started in, I think, 1919. So it talks about what it is, who is eligible, and it continues to go on. And then here you would go to search by program name and brings you into the 2-on-1 database, and you can find more information, the phone number, the website, how to get directions, and other details about this particular program and the documents required to apply for it. So this is also a very useful section if you're working with military personnel to show them the various e-library papers that would be relevant to their situation. Veterans medical services, veterans benefits and organizations, and on the other end, if you were looking to support the U.S. troops, how you would go about doing that. One other one is the support groups, which would be a variety of different support groups that they may be interested in. One other way that we offer a connection to resources are through our specialized directories. Each of these are print directories that you can download and print, because even though, you know, you're going to get the more up-to-date information if you're online, but often you're in a situation where you're not online or that you want to hand it out to someone. So these offer our users an opportunity to print these documents out and give it to someone. So each directory includes the agencies, the addresses, the description of services available, and other very key information, very similar to what you would find on the website. So we have several reentry guides from Bridgeport to Waterbury to Windham County to Hartford. These help you find services if you are exiting the criminal justice system. We have one on where to turn in Connecticut when you become unemployed, which provides information on state, federal, and local resources to help people who are unemployed and are looking for jobs. The HIV/AIDS Prevention and Care Guide provides information that will help you understand the HIV/AIDS prevention and care options in Connecticut. The Healthcare Resource Guide is intended to provide information on state, federal, and privately purchased health coverage programs for Connecticut residents. And it also provides information about obtaining health care when you are uninsured, ineligible for state and federal programs, or unable to pay for the cost of care. One of the other ones is the Special Resource Directory for Connecticut Veterans, Active Duty, National Guard, and Reserves. So that is available online as a PDF. And basically, it starts out with giving the numbers for the General Veterans Information Lines and the United States Department of Veterans Affairs. And then it goes on to provide sort of a directory of services on whether it be basic needs, consumer services, legal services, housing, healthcare, income, family life, mental health. So if you scroll down, as we scroll down through the document, you'll see here different, it'll describe the program. It will say what their email is, where their website is located, so that if someone, once you've handed this out and they say, oh, I'm really interested in this American Job Center, here's the phone number, here's the address, here's telling me, what it provides. So it's another resource that someone can be connected to services here in Connecticut. But this is particularly geared, this one is geared towards active military and veterans. Another way that we would connect our military personnel to services is through through housing. You may or may not know that 211 is the front door to the state's Coordinated Access Network. So if you know someone or you're working with someone who is in need of shelter or they're experiencing a housing-related crisis, they would dial 211, select option 3, and then option 1, where then our contact specialist would assess their situation and provide shelter diversion options. So that is one way that if they're in a crisis situation with housing, they would go through the CAN network. But they can also, we also offer a site where they can sign up for the housing voucher program. I think it's previously known as Section 8. Here you can locate open housing choice voucher waiting lists throughout Connecticut, and you can register to receive an automatic notice of the opening of a waiting list where they occur. So let's say you live in Meriden and you want to know, like, I want to get on that list as soon as it's open. If you register, you would get an email notification saying it's open. So that is found on our website as well. Another way that we are looking to connect people to services are through screeners. So one of them would be the 211 Navigator Benefit Screener. It's a series of questions that allows us to generate a list of some state and federal programs that may be able to help you or your client. What the user does is they go through and answer a series of anonymous questions. There's no personal identifiable information that's collected. It'll say, here's an example of some of the questions. Do you live in Connecticut? How old are you? How many children in your household? Is anyone pregnant? And once you answer these questions, you will receive sort of a list of what you may qualify for and then how to apply for them. The screener doesn't guarantee that you will qualify, but it can sort of give you an idea if it's worth your time to apply. Another one of screeners that we've recently have on the website is the Healthy Lives Navigator. And this is to do around social determinants of health, which are the circumstances in which an individual is born and live that impacts their health. These may include factors such as their economic status, their cultural environment, where they live, their access to health care and education systems, their safe, how safe are their living conditions. So by answering, like the 211 Navigator, this Healthy Lives Navigator goes through a series of questions, once again, non-identifiable information. So it's designed to screen for these social determinants of health. And then once it's completed, either a healthcare provider or a social worker can access for the 11 social needs that are most closely linked with poor health outcomes. So what happens is they'll fill it out, and then you will be given a list of resources that are related to the answers to your questions. So you might, in your answers, you might indicate that you are food insecure. So in the results, you will get a list of resources that will assist you with access to food resources. Another resource for veterans is our community calendar. This lists upcoming events for programs and agencies that are in our database. You can filter by category, day, or location. And as you can see here, one of the categories is veterans. So here they would be able to see, oh, maybe there's some job interviewing workshops that I can attend, or maybe there are some volunteer opportunities that I would like to explore, or maybe there are some trainings on, some workshops on how I sign up for healthcare. So here, by going to our community events calendar, you can filter it by a particular topic, such as veterans or recovery. So my 211 account will allow you to create and share resources so that you can keep programs and easily pass them on to others that you are working with. So for example, if I'm working with someone and I feel that, this veteran has some needs for food, for housing, and health care, I can go on and sign up for my 211 account, which is free, and I can work with this person, and we can go through the database and select various resources. So I may choose Agency A for food, Agencies B and C for housing, and Agency D for healthcare. I click that and add that to my list, and then I'm able to share that list with this individual either through email or a text message, so that when they are back home, they can quickly see their email. Oh, here's that list that I can explore these different resources that will help myself and my family address some of the needs I'm looking for. And we'll go into more detail on that when we go on the website. Another way to help in finding resources for veterans is our targeted search. So when you're on our main page of 211ct.org, if you type in veterans, you will get a drop-down where you can select veterans, and this will give you all services related to that targeted population. So here you'll see on the right, it showing there were 270 results for this one keyword of veterans. So that I did it statewide, but you can definitely narrow that down by a particular city or zip code. So let's take a look at the website and go through the three main ways that you would search on 211 to help someone locate resources. So just a quick reminder about, the things we talked about earlier is the e-library. Here you will find that topic related just to veterans. Under professionals, you will find the specialized directories, where here is the one for Connecticut veterans and active duty. And on the home page, you will find a link to the community calendar down at the bottom of the page, as well as a link to the housing voucher program. The 211 Navigator is at the bottom, and the Healthy Lives Navigator screener is here at the top, that you would just have to click on that and go ahead and answer those questions. Now, we offer, similar to where I said that we always want to have multiple doors for people to access resources. We have multiple ways that they can search. One is this category search. So whether it be food, crisis, mental health, utility assistance, children and families, if someone were to click on this, we're basically helping guide someone to what they might need, because I know I need help with food, but I don't really know how to search for it. So I might come here and say, oh yes, I'm looking for a food pantry. So this will bring them into the database, and here they can choose their city or zip code and to find a resource in their area. So the category search just really helps someone narrow down search if they're really not sure what to search for. And very similar to housing, same thing, am I looking for a homeless shelter? I'm looking for rent payment assistance. The suggested reading are the e-library papers. I might need information on eviction. I'm being evicted, and I want to know what my rights are. That is one way to search. Another way to search is if you click in the search box here, you will get suggested searches. These are our problem statements. So these are statements over the years that we have found very common requests from our callers. I need food. I need counseling services. I don't have enough money to pay my bills. I need health insurance for myself or my family. So if you were to click on one of these, let's say my utilities are going to be shut off. So you choose your town or zip code, and then you hit search, and it brings you into the agency's programs and services that are related to that problem statement. So again, it's a way to help people hone in on what they're looking for. And the main way is through this keyword search. You can just start typing anything. And you'll notice as you type, you'll get some suggestions. You can either choose that. I started to type in food, so it says, oh, are you looking for food pantries? Are you looking for baby food? So again, this really, we want to help the user kind of narrow down what it is they're looking for. You can choose one of these, or you can ignore it and just, use what you've typed in. So if I were to say, you know what, I'm looking for food pantries in Hartford, and I hit search, it will bring me into resources. And here I just want to call your attention to the filters. I might you can filter by days open. If you're working with someone and, you know, they need a food pantry for Friday, click on Friday to say, well, if I choose Friday and filter the results, I can then tell this individual, these are the agencies that you can go to on Friday to get help with food. So for the advanced filters, that's always an option. You can either do it by days open, by gender, by age group. These aren't relevant for all services, but, you know, in many they would be relevant. And you can also do it by target population, as I mentioned earlier, like for veterans. So here, I'm quickly running out of time, so I just want to quickly show you that, you know, if I were to log into my 2-on-1 accounts, and it's free to create one of these My 2-on-1 accounts. Here's where I could say I want to add this particular program to a list that I have created. I can create a list from here to say, you know, or I can select from a list I've already created. So I want to add this to my food list. And so now I want to share it with someone. I can either print it or I can email it or send a text message to this person to say, well, here's this list I put together for you of food resources, or here's a list I put together for you. Say I'm working with someone named Paul. I put together for Paul a list of resources around healthcare, food, and housing. And this way, then on his own time, he can go through these resources without having to come in and recreate the searches himself. So it's a great way to share lists. And it's also a great way to create a little mini directory if you're finding you're working with a particular target population that they have similar needs. You can create a little mini directory using this My 2-on-1 account. So I quickly also want to draw your attention to a site that United Way of Connecticut does, is Healthy Lives Connecticut. This gives you the opportunity to actually do another type of screening because it's very important, you know, just like when we go to the doctor and we get our screening for blood pressure to detect warning signs, a mental health screening also provides us that quick, anonymous way to recognize individuals who may be at risk for treatable mental health disorders or alcohol disorders or depression screenings. So by going here, someone can quickly take one of our online screenings. And so then it will ask them, you know, are you worried about my drinking habits? This would be for an alcohol use screen, about gambling, depression, anxiety, substance use, eating disorders, and a post-traumatic stress screen. So, you know, if you're working, if someone that you know, you feel maybe their husband who has returned from military service, they're worried about, is he suffering from post-traumatic stress? He or someone that they know can quickly sort of answer these questions and get a sense of should they seek professional help. So it quickly asks a few questions about that they can go through, and then and at the end it will say, you know, based on your answers, it appears that you may suffer from post-traumatic stress. I want to say that, you know, this definitely isn't in replace for professional help. It just gives you an opportunity to take that next step to say, do I need to have a conversation with my husband because I feel that, you know, he is suffering from this, and where can we get help? So this is just another opportunity. This is another resource for folks to connect to resources in Connecticut. All the resources, most of the resources on Healthy Lives Connecticut point back to 211 database. So here, if under emotional wellness, you will find links to our e-library papers as well as links back to our resources. So it's just another site that someone can connect to resources here in Connecticut. And on that, I think we're out of time. So I want to thank everyone for attending. And if you have any questions, please go ahead and put it in the Q&A. You will be sent a link to the webinar. And just a quick, let me just do a quick overview of the resources that you can use to connect veterans and active military in your area is, again, the special section in the e-library, the professionals, the directories. On the home page, not only can you search 3 ways, but you can search the target population of veterans to find a quick all resources around the veteran population. You can refer them to the community events calendar if they're looking for trainings and workshops, and the Healthy Lives Connecticut, the screenings that you can find on Healthy Lives Connecticut, and the screenings that you can find on the homepage of 211 Connecticut, the 211 Navigator, and the Healthy Lives Navigator. So as you can see, it's just a multitude of resources that are out there. It's just a matter of connecting people to those resources, and we hope that you can get the word out to this population about these resources. Thank you.